So, good day everyone. I'm Betty Mayu Hernandez, first year college from BSN 1D. So now I'm going to demonstrate to you the assessing the neurological system with our patient. First, I'm going to introduce myself to my patient and verify his name. So, good day sir. I'm Betty, your student nurse for today. May I ask what is your name?
Ivan.
Ilang taon na po kayo?
20.
So next, we need to explain to our client what we're going to do and why it is necessary. So sir, ngayon po, iti-test po natin ang inyong neurological system. Okay lang po ba sa inyo yun?
Oo.
Para malaman po natin if may abnormal findings po sa inyo. Next, we need to do the hand hygiene. So the rationale of this is to avoid the spreading of microorganisms or the cross-contaminations among patients or clients. Okay. So the next is we need to provide for client privacy. So for example, we need to close the door or close the curtain. So the rationale of this is for the patient to be comfortable in the whole procedure that we will be doing. Next, we need to ask the following with our patient. So sir, do you feel any presence of pain in your head?
Wala.
Sa likod niyo po?
Wala.
Nagkaroon na po ba kayo ng speech disorders?
Wala.
Any history of loss of consciousness po?
Wala.
Naranasan niyo po na po bang magka-convulsion?
Hindi pa.
Trauma po?
Hindi pa.
Tremors po?
Hindi.
Or paralysis?
Hindi rin.
And, naka-experience na po ba kayo ng loss of memory? Mood swings po? Okay. So, sir, do you have problem with your smell,
Wala.
visions,
Wala.
taste,
Wala.
touch?
Wala.
Okay. So, next we will assess the language or we will check the language with our patient. So, we will check if the client has difficulty in speaking. Okay. So, sir, pwede niyo po bang basahin to?
Assessing the neurological system.
Okay. So next, we need to do the orientation. Determine the client's orientation to time, place, and person by tactile questioning. Sir, saan po kayo nakatira?
Ang bahay.
Anong barangay po?
Perdona. Tarlac.
So, ano na pong date ngayon?
May 8.
Okay. So, sir, can you please give me some name of your family members? Kahit isa lang po.
Michelle.
Okay. So next, we will assess the memory, ask the client about difficulty with memory. So sir, pwede niyo po bang ulitin po lahat ng sasabihin ko pong numbers? 1, 3, 5, 4, 8, 12.
1, 3, 5, 4, 8, 12.
Okay. So next, we need to check the attention span and the calculation. So sir, pwede niyo po bang i-recite sa akin ang 1 to 20 na numbers?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Okay. So next naman po is A to J.
A, B, C, D, E, F, G, H, I, J.
Okay. So thank you sir for your cooperation. Now we will proceed in the first procedure with our patient. Okay. So now we will proceed in testing the cranial nerve. First, we will test the cranial nerve number 1, which is the olfactory. Now, we need to ask the client to close their eyes. So, sir, pwede niyo po bang close yung eyes, no? And then, we need to identify different mild aromas. Okay, so, sir, can you please identify this?
So,
Okay. For the next one.
sweet.
Okay. So after testing the cranial nerve number 1, which is everything is correct and normal, we will proceed in the cranial nerve number 2, which is optic. So for the cranial nerve number 2, which is optic, so sir, pwede niyo po bang takpan po yung isa niyo pong mata? And tingin po kayo sa akin. Okay, so sir, nakikita niyo po ba to?
Oo.
Ilan po?
Dalawa.
Ito po.
Okay, kay tatlo.
observe of our patient, everything is normal. Now we will proceed in the cranial nerve number 3, which is the oculomotor. Now we will assess the 6 oculomotor movements. So, sir, pwede po ba kayong tumingin sa taas? Sa baba po. Sa side po. Sa side po. Okay, so everything is normal with that. Next, we will proceed in the cranial nerve number 4, which is the trochlear. We will assess again the 6 ocular movements. So, sir, pwede po ba kayong tumingin sa taas? Sa baba po. Sa side. Side. Sa side. Side. Okay, so everything is normal. Now we will proceed in the cranial nerve number 5, which is the trigeminal. While the client is looking upward, we need to lightly touch the lateral sclera of the eye to elicit the blink reflex. Okay, so sir, pwede po ba kayo tumingin sa taas? Okay, so everything is normal with the cranial nerve number 5. Now we will proceed in the cranial nerve number 6, which is the abducens. We will assess the direction of gaze. So, sir, pwede po ba ang tumingin sa taas? Sa gitna. Okay. So, everything is normal with the cranial nerve number 6. Now we will proceed in the cranial nerve number 7, which is the facial. So, ask the client to smile. So, sir, pwede po ba kayo mag-smile? Raise the eyebrows. Frown or sad face. Next is the pop out cheeks. Okay. So, next we need to ask the client to close their eyes tightly. Please close your eyes po. Okay. So now we will proceed in the cranial nerve number 8, which is the auditory. We need to assess the client's ability to hear spoken words or any sounds and vibration tuning fork if present. So, sir, naririnig niyo po ba yung ceiling fan? Wala po bang problema? Okay. So everything is normal with the cranial nerve number 8. Now we will proceed in the cranial nerve number 9, which is the glossopharyngeal. We need to ask the client to move tongue from side to side and down to down. So, sir, pwede niyo po bang going side to side? Okay. So now we will proceed in the cranial nerve number 10, which is the vagus. We need to ask the client to speech for horniness. So, sir, pwede po ba kayong bumulong sa akin ng mga words? Any words? Bulong po. Hindi na yung boss. Okay. So, it is good and normal. Okay, now we will proceed in the cranial nerve number 11, accessory. Now we will proceed in the accessory, which is the cranial nerve number 11. Ask the client to shrug shoulder against resistance from your hands and to turn your head to side against the resistance from your head and do that vice versa. Okay, so sir, pwede niyo po bang kontahin po yung kamay po? Sa baba po. Sa side po. Okay. So, everything is good. Okay, now we will proceed for the last cranial nerve number 12, which is the hypoglossal. We need to ask the client to protrude tongue at the midline and then move it from side to side. So, sir, pwede niyo po bang gayahin yun? Okay. So, everything is normal. So, now we will assess the motor function, the gross motor and balance test. First, assess the walking gait. We need to ask the client to walk across the room and back assess the client's gait. Okay, so sir, pwede po ba kayong maglakad po hanggang dito, tapos hanggang dito po? Okay. So, everything is good with that. walking. Now we will proceed in the Ramberg test. So with this test, we need to ask the client to stand the feet together and arms resting in the side. First with open eyes, then second with the closed eyes. So sir, pwede po ba kayong tumayo po dito? And then straight body and open po yung eyes nyo. Next po is closed eyes. Okay, pwede na po kayong umupo. So everything is good with the test, everything is normal. Now we will proceed in the standing on one foot with eyes closed. Ask the client to close eyes and stand one foot, then vice versa. So sir, pwede po kayo dito. Tayo po kayo gamit po yung right foot niyo lang po. Close eyes po. Okay, sa kabila naman. Okay, pwede na po kayo umupo. So next, we will proceed in the heel-toe walking. Ask the client to walk a straight line, placing heel-toe on one foot directly in front of the toes on the other foot. So sir, ganito po yung gagawin nyo. Ganyan po, ganyan po, ganyan. Ganyan. Okay, dito po kayo mag-start. Sabi, 1, 2, 3, go. Okay, thank you po sir. Pwede nito kayo po. So, okay, so everything is good and normal with that, all of the tests. Now we will proceed in assessing the fine motor test for the upper extremities. Okay, so now we will first is the finger nose test. So ask the client to abduct and extend arm, shoulder, high up and rapidly touch nose alternately with one index finger, and when the other have the client repeat the test with eyes closed if the test is performed easily. So sir, pwede niyo po ba itaas po muna? Then bigla niyo pong ipunta sa nose niyo yung right hand, ganun po. Sa kabila po. Mabilis po. Okay. So with closed eyes naman po. Ganun po. Ulitin niyo po yung procedure. So everything is normal and good with the flow with that test. Okay, so for the fingers to fingers, ask the client to spread arms broadly at shoulder height, and when brings fingers together in the midline, first with closed eyes and then close. So sir, ganito po yung gawin nyo. And then mabilis nyo pong ipunta yung mga fingers nyo po. Okay, so open eyes po muna tayo. 1, 2, 3, go. Next po, closed eyes po. 1, 2, 3, go. Okay, so everything is good with that test. Next is the fingers to thumb. Ask the client to touch each finger of one hand to thumb at the same hand. So, sir, ganito po gawin. Okay, 1, 2, 3. Okay, thank you, sir. So, now we will assess the light sensation. Compare the light touch sensation of symmetric areas of the body. Okay, then ask the client to close eyes and to respond by saying yes or no whenever the clients feel the cotton, and then ask the client to point the spot where the touch was felt. Okay, so sir, sabihin niyo po sa akin kung nararamdaman niyo po yung cotton, and then kapag nag-yes or no na po kayo, ituro niyo po kung saan ko po pinunta yung cotton. Okay po? Do you feel it po, sir?
Yes.
Sir, di po yung people sa bukan. Okay? Do you feel it, sir? Do you feel it, sir? Okay, so everything is good with the test. Now we will proceed in the pain sensation. Ask the client to close his or her eyes, then say sharp or no skin. Touch the skin areas with sharp or dull. Okay, so sir, I'm gonna touch this object with your face and tell me if it is sharp or not, okay? So, sir, do you feel any? It is sharp or hindi po?
Hindi.
Dito po.
Yes.
Sharp or hindi? Okay. So, now, we will proceed in the temperature sensation with our patient. We need to touch skin areas with test tubes filled out with hot or cold water. Then the client will respond saying if it is hot, cold or it doesn't feel any. Okay. So, sir, tell me if the temperature is hot or cold. Okay? Yung kamay niyo po, ganito po. Hot or cold?
Cold.
Hot or cold? Okay, thank you, sir, for your cooperation. For that temperature sensation, everything is good and correct with the response. Now we will proceed in the tactile discrimination. For this test, the client's eyes need to be closed. So, sir, close yung eyes, no? Okay. So, everything is good and normal. Now, we will proceed in the first is 1 or 2 discrimination, which is stimulate the skin with 2 pins, simultaneous, and then with 1 pin as whether the client feels 1 or 2 pins. Okay, so, sir, pwede po ba kayong magganito? Close eyes po. Sabihin niyo po sa akin kung ano po yung mas nararamdaman niyo, yung with 2 pins or with 1 pins. So, sir, ano po mas nararamdaman niyo? Okay, so mas nararamdaman niyo po yung dalawa. Okay, so it is correct and good. Now we will proceed in the stereognosis test. Place a similar object such as key, paper clip, coins in the client's hand and ask the client to identify them. Okay, so sir, close eyes. Sabihin mo sa akin kung ano po yung first po. Yung kamay niyo po isa. Ano pong nalalaman niyo?
Pen.
Okay, tama. Eto po.
Kitchen.
Okay, eto po.
Tea.
Okay, so it is good. So everything with the test is good and normal, and actually I don't feel any or I don't see any abnormal findings with all the procedures that I've done. Okay, so sir, do you feel any pain po ba with the test? Okay. So, after all the procedure, we will now document all the data, all the information that we've done with our patient. Okay, so after the documentation, after all the procedure, we need now again to do the hand hygiene. Okay, so that's how I demonstrate to you the assessing the neurological system with our patient.